Hello everyone, this is Emily Cao, Junior Editor for the Academy of Online Radiology Education. Today we're diving into 3 recent articles from Emergency Radiology that highlight how quantitative CT findings can improve clinical decision-making in the emergency setting. In this study, the authors investigated the usage of the intestinal to liver CT attenuation ratio as a quantitative tool to predict resection in strangulated small bowel obstruction. The method is straightforward. Take the Hounsfield units of the most hypo-enhancing portion of the affected bowel wall and divide it by the attenuation of the liver parenchyma, which acts as a reliable internal control. Patients who needed resection had significantly lower attenuation ratios, and a cutoff of less than 0.40 predicted surgery with 92% accuracy. The model had an AUROC of 0.886, suggesting excellent discriminative ability. For reference, 1.0 is perfect and 0.5 suggests no better than chance. This ratio offers a way to move beyond subjective impressions like decreased enhancement, giving surgeons an objective metric to support early intervention, particularly in ambiguous cases where visual signs may be subtle. This next article focuses on trauma imaging. Mueller et al. Introduced the Shock Thyroid Imaging Score, or STIS, to quantify what's often referred to as shock thyroid, a constellation of imaging findings including thyroid hypoenhancement, heterogeneity, swelling, and parathyroidal fluid. Each of these 4 features is scored from 0 to 2, giving a maximum total of 8 points. Higher STIS values reflect more severe imaging signs of systemic shock. The results were significant. In a cohort of over 700 trauma patients, those with STIS greater than 3 had a 50% in-hospital mortality rate, compared to just 13% for those with normal-appearing thyroids. What's more, STIS outperforms both the Glasgow-Coma scale and systolic blood pressure in predicting mortality. That's particularly important in trauma settings, where vital signs can fluctuate or be masked by medications and resuscitation. By using something as consistently imaged as the thyroid gland, STIS offers a reproducible way to flag high-risk patients early, even when they don't appear unstable yet. Spontaneous intracerebral hemorrhage, or ICH, is one of the deadliest forms of stroke, and early hematoma expansion is one of the strongest predictors of poor outcome. In this prospective study, Gonzalez-Dominguez and colleagues compared 2 contrast-enhanced CT findings, the spot sign, which appears on arterial phase CTA, and the leakage sign, which shows up as progressive hyperdensity on delayed phase imaging. The results were clear. While both signs were predictive, the leakage sign consistently outperformed the spot sign across all key outcomes. Patients with the leakage sign had 9 times the odds of hematoma expansion, 26 times the odds of neurologic decline, and over 7 times the odds of in-hospital mortality. Unfortunately, their median survival was just 6 days, compared to 54 days for the spot sign alone and 110 days for patients with neither. This study supports the routine use of delayed phase CTA in ICH protocols, especially since the leakage sign may detect ongoing extravasation that's missed on a single snapshot. By identifying high-risk patients earlier, radiologists can help guide ICU triage, neurosurgical consultation, and prognostic discussions right from the first scan. To wrap things up, these 3 studies represent a growing trend in emergency radiology. The move towards standardized, quantifiable imaging tools that don't just describe what we see, but predict what's likely to happen. We're seeing CT take a bigger role in early triage, from identifying ischemic bowel before it's irreversible, to quantifying systemic shock on a trauma scan, to forecasting deterioration in intracerebral hemorrhage. These tools offer reproducibility and risk stratification, which is especially important in settings where clinical exams are limited or time is critical. While prospective validation is still needed, the direction is promising. Together, these studies highlight how reproducible CT-based metrics like attenuation ratios, scoring systems, and contrast dynamics are reshaping emergency radiology. Thanks so much for watching. For more research highlights in radiology, check out the ACORE blog series. See you next time.